for tuning in to these daily press conferences. It continues to be the very best place for you to get your information. It's up to date, it's accurate, and it's based on facts, not frenzy. Everything that we tell you here, you can trust, and I would encourage you to take some time to tune into these press events every day so you can keep yourselves up to date. Facts are the best way, information is the best way you can keep you and your family safe as we live through this very fast evolving crisis. Today I'm very sad to begin by reporting another 3 deaths here in the state of Rhode Island on account of coronavirus, bringing us to a total of 17 deaths. We have 97 new cases in Rhode Island, bringing us to a total of 806 cases of coronavirus, and very unfortunately 93 people in the hospital. The hospitalization number continues to climb at a very rapid rate over this past week, which just confirms for us that we are in a rapid spread phase of this virus, and it's just another stark reminder to all of us that even though we're getting it's getting more and more difficult to follow the directions and stay at home, now is when it matters the most. So to all those families who've been affected by coronavirus, our thoughts and prayers are with you. And to the rest of Rhode Island, just obey the stay-at-home order so we can limit the amount of sickness and death and sadness here in the state of Rhode Island. In some ways, I can't believe we've been at this for a month, but in other ways, it feels much, much longer than a month. In fact, at this point, every day blends into the next day, and they're all kind of an endless day. All of us are out of our normal routine. Most of you are not going into the office. We're not dropping our kids off at school in the morning. Today's a Saturday, we're not going to the field to watch our kids play sports or go watch our sons and daughters in dance performances. Religious gatherings and support groups have all been suspended. So that's really tough. It's really hard. All of us are out of our routine, and that makes it even harder to stay grounded in any circumstances, especially now that we're dealing with this crisis. I dressed a little more casually today just to remind myself and all of you that it's a Saturday, it's a weekend, even though Saturday these days feels just like every other day. I want to take a second to urge everyone to do whatever you can to keep yourself in some kind of a routine. Get up in the morning and get dressed. You know, if usually maybe on the weekends kids go see their grandparents, you can't go see them, but maybe call them today. Try to exercise every day. Do your best to eat healthy. Get some time outside every day. It's good for your physical health. Little vitamin D will help your immune system. It's good for your mental health. But just take a minute today to acknowledge how hard this is. This is so hard for all of us. No one is in a routine now that they feel good about. But take some time today just to try to ground yourself in what are some routines that will help you keep it together as we go through the weeks and months ahead. And as I've said so many times, don't let yourself get isolated. You can't see people, but I talked to a friend this morning and she was hosting a virtual dinner party tonight. So get creative and make sure you have semblance of routine and find ways to reach out to people to have that human contact that we all need right now. And I'll just let you know, if you're struggling, you're not alone, because we all are. I also, since it's a Saturday and we can all have a second to breathe, I want to begin today expressing to you that I have a great sense of gratitude. Every day, at the end of the day, my team and I have a phone call, and we go around the horn and report on where we are and what's happening. And we're all exhausted, and we're all chronically behind. But last night on the call, the thing that everyone expressed was this sense of gratitude. And it's so true, because although it's tough and getting tougher, and although I can't stop the bad news from coming, it's gonna be bad, it's bad and getting worse, please take some comfort in knowing that for more than a month now, thousands of people all around Rhode Island are working around the clock to keep you and your family safe, and to do everything we can to make this a little bit better and a little bit safer and a little bit healthier for everybody. It started a month ago with our unbelievable, dedicated, and inspirational team at the Department of Health, led by their fearless leader, Dr. Nicole Alexander Scott. And then my own staff, who I have to tell you, I'm more proud of them than I've ever been. The way they're working, their commitment, their resilience, and their persistence. And now, of course, it's extended throughout Rhode Island. Doctors, nurses, hospital staff, nursing home staff, home care workers, first responders, law enforcement, hundreds of National Guard members, dedicating everything they've got to this crisis. I want you to think about the teachers, principals, superintendents, parents, and RIDE staff who've turned their lives upside down to make sure that we can educate 142,000 school kids all around Rhode Island. The hundreds of people volunteering their babysitting services to other Rhode Islanders on care.com. The nonprofits making sure that our most vulnerable have their basic needs of food, clothing, and shelter met. Employees who go to work every day, even though they're tired and they're scared and they may or may not have great child care and family support, so that you and I can buy food and medicine and pharmaceuticals. The dozens and dozens of manufacturers stepping up to the plate to create the personal protective equipment that we all need to stay safe. And to each and every one of you, every single one of you, there's not a Rhode Islander out there who isn't struggling in some way to deal with this crisis. And by and large, you are doing an amazing job. The heroes in this fight are the everyday Rhode Islanders stepping up to obey the quarantine, stay home when they're sick, shut down their businesses because it's the right thing to do, even though it is so hard. The moms and the dads who are reassuring their kids, kids listening to their moms and dads, and neighbors checking in on each other and on that elderly neighbor or loved one who cannot go and shouldn't go to the grocery store, so you're giving them a hand. Everybody's saying we're going to get through this together, and it's true. And by the way, we are getting through it. We're doing a lot better than many states, and we will continue to get better and better every day. Starting tonight, we'll be lighting the State House red for the next week. Why red? Red is typically the color we associate with our first responders. The traditional first responders, law enforcement, and healthcare are absolutely out there working 24 hours a day on the front line of this crisis to keep us safe. But as I just said, in this instance, this fight, it's much, much broader than just what we think of as the traditional first responders. It includes everybody I just talked about. Everybody, thousands of people all around this state pitching in to do what's required at this moment of crisis. So tonight, if you're driving home from work and you're a little bit tired, you're exhausted, you're burned out, I want you to look up at the State House. I want you to see that red dome and know that that's a big thank you from every Rhode Islander to you for doing what you're doing to work so hard to keep all of us safe. And it's also a personal thank you from me to you, because I know how hard you're working. A few specific announcements on the more practical side around how we get through the next stage of the crisis. I want to make a special note about testing. Every day we learn more about how to deal with coronavirus. And what we know now is that the testing is absolutely critical. We need to get to a place where everybody who needs to be tested or wants to be tested can be tested. That's our goal. We aren't there, but that's where we need to be going. And I had a meeting this morning, a call this morning with the testing team. They are on it. We are moving. By this time next week, we're going to be in even better shape than we are now, by a lot. Having said that, I want to make a special note about testing. For a long time, I was telling you, Dr. Scott was telling you, that we couldn't test everybody, and we were asking you for patience not to try to seek a test. Now I'm telling you something different, so I want to really drive it home. Because of the hard work of an awful lot of people in the National Guard, Department of Health, our whole team, we now have a system set up where we can swab and test well more than 1,000 people a day. So I no longer want you to be shy about coming forward. If you think you have coronavirus symptoms, I want you to call your primary care provider, call your pediatrician, call an urgent care center, call the Department of Health hotline, and go ahead and see if it makes sense for you to get tested. Because just today, I want you to know, we have over 1,000 people scheduled to be swabbed and tested. And I want to have that happen every day from now on. We need to catch up because we're behind, so we need to be testing more now to catch up. If you're a primary care provider and you're hearing this, I want you to please ramp it up and send more patients for testing. We have the capacity, we have the capability, and we're open for business, and we want those referrals to keep coming so that we can catch up and have ubiquitous testing in the way that we need to fight this crisis. And to those of you who are out there, by the way, in the rain, doing the drive-through, the swabbing, I want to thank you extra for your bravery and for your hard work. I do want to say, just because we have the ability to test, to swab, and to test, it doesn't mean you're going to get a result immediately. We're still not there yet. That's like the next piece of this. We'll get more quick results. So if you go get tested today, chances are you're not going to get the result of your test for a few days. But that's okay. Get tested, keep yourself quarantined, and if you're sick, isolated. You'll have your results in a few days, and I hope that in a week or two from now, the results will get to you even more quickly. But please get that word out, and again, if you're a physician, start sending us these patients. This is a special weekend in that it is Palm Sunday. Tomorrow is Palm Sunday, and for those of the Christian faith, it's a holy day, a very holy day, religiously, of course, but also culturally. For those of us who are Italian, it's a big deal. And for many folks out there, I know this is the first and only time in your life, and hopefully the last, that you're not going to be able to celebrate Palm Sunday with your faith community in church. So I want to acknowledge that. And it isn't just Christians, although Palm Sunday is Christian, but, you know, for our brothers and sisters of all faiths, synagogues are closed, mosques are closed, all faith communities have closed their physical doors. And that's really difficult. It's back to what I was saying. We rely upon these communities and being with people to keep ourselves grounded and focused and give ourselves a sense of purpose and community. So I want you to know I know how hard it is. My family and I are living how hard that is, just as you are. But having said that, I do need to make a very serious note about Palm Sunday. And I want to talk directly to every parish, every priest, every family. As both Bishop Tobin and Bishop Knisley have said, and I want to thank them both for their cooperation, there should be no church services tomorrow at churches. You can watch online. All the parishes and the bishops are doing their very best to make sure that this church broadcast on TV, on Facebook, participate, but I don't want to hear tomorrow that certain churches were open, certain people were sneaking into churches to try to have Mass or receive communion or go to a service. Furthermore, there will be no distribution of palms. And again, I know that is hard, really hard. We know that this virus sticks to surfaces, and it lives on surfaces for days, many days, which means it will stick to the palm, which means if we have lots of people, especially older people, going to receive their palm, we could have a huge disaster on our hands. So again, I want to thank the bishops, and I want to thank all the priests and parishioners for their cooperation. I want to thank the bishops for putting this guidance out. Tomorrow is a day to celebrate. Tomorrow is a day to worship. Tomorrow is a day to be with your faith community virtually. It is not a day to go to church, in physical church, and it is not a day to try to find palms. And I'm sorry to be so harsh about that. It kills me too. We have our own traditions on Palm Sunday. But for now, for tomorrow, for this crisis, it would just be too dangerous. And we'll figure out ways going forward to make it better as we move forward with this crisis. Parks and beaches, just a reminder, it's the weekend. We've closed parks and beaches, so I want to be very clear about this. You cannot park your car at the park and the beach. If you are lucky enough to live close enough to a park or a beach, then go ahead and go for a walk. But we don't want you trying to drive there. We don't want you parking in the street along, in the road that leads up to the park or beach. That'll create a nightmare for municipalities and local police who are doing their best right now. It's a great day. We want you to go outside. Go for a walk. As I say, if you're lucky enough to be near a park or beach, go ahead, but do not congregate in large crowds. We have extra DEM patrols on today and tomorrow, and if we see you in a large crowd, we will break up the large crowd. So just don't do it. Go for a walk with 1 or 2 people in your family, keep a safe distance, enjoy the day, but just don't push the limits of the rules. They're rules designed to keep you safe, healthy, and alive, and everyone in Rhode Island safe, healthy, and alive. Last thing, yesterday I was asked a question about price gouging at hotels, and at that time I wasn't certain of what the answer was. Since then, we have been in touch with the Attorney General and also the Hospitality Association, and I have been assured by both of them that there is no instance of price gouging at hotels, so I want to assure everybody that that isn't happening. I'll make a special note that this is not a time for price gouging of any kind. I want to remind you it's actually illegal, and the Attorney General is absolutely prepared to enforce that. Price gouging is against the law, and we're on it, we're focused on it, we're monitoring it, and we will enforce it, and you will be punished if you try to do that at this time and take advantage of anybody during this crisis. And I can tell you with certainty that in the hotels, we don't feel we have a problem right now. To the hotel operators and to everyone in the hospitality business, I just want to give you a special expression of sympathy. I know this is unbelievably difficult, and we're talking every day to you and to restaurants and everyone in the hospitality business, and we're going to be as aggressive as is safely possible and as creative as we can be to help you sustain your business now and in the months to come. I don't have a great answer today, but I want you to know we're thinking about it, we're working on it, and it's not lost on me at all how tough of an economic situation that you're in.